doctors, I feel, should spend a bit more time. I think one of the main problems that the doctors are facing is that they're not spending enough time with the patients. I think they should spend a little bit more time into explaining to them. So when we started off in medicine as an MBBS student, the world was absolutely different, and medical profession is changing very rapidly. In fact, cardiology also is changing. I think one of the most rapidly changing fields that we are seeing. Even what I had learned in DM course in PGI Chandigarh 30 years ago has totally changed now. In fact, we didn't have transesophageal echocardiography, a special mode of investigating cardiac cases in PGI Chandigarh. I learned that in Safdarjung Hospital. I've done hundreds and hundreds of cases in Safdarjung Hospital, transesophageal echocardiography. They had a very beautiful machine there. In fact, I set up their small cardiac laboratory in Safdarjung Hospital in the old building, which has now been demolished to make that flyover. So there I set up their cardiac lab, and I was the first to actually implant a pacemaker in Safdarjung Hospital, I think way back in 1995, 1996. So the world of medicine is absolutely changing, so much so that now we are having at least 5 subspecialties of cardiology. It has now become impossible for any single human being to know everything that is to know about cardiology, and it has now actually split up into 5 particular branches. One branch is very obvious, those who look after children, pediatric cardiology. And pediatric cardiology has now become a specialist branch. Then of course you've heard of all those people who put in stents here and stents there and all that. So they are the interventional cardiologists. Again, the technical advantages, the technical advances have been so much that is again frankly impossible for, say, a pediatric cardiologist to follow up every single thing there is to follow up in interventional cardiology. That's become a specialized branch. Then you may or may not know there is another branch whom we call cardiac electricians. They are the cardiac electrophysiologists. We call them cardiac electricians, and they look after the rhythm problem of the heart. When your heart is racing or when your heart is not beating properly, the rate is low, then they are the persons who actually look into the matter and they correct those rhythm abnormality. They are the cardiac electrophysiologists. So 3 things I have already said. The 4th is of course the support wing of cardiology. I wouldn't say support, but they do support cardiology. That means the non-invasive cardiologists. They do the echocardiograms, the dobutamine stress echo, and so on, transesophageal echo. They help the surgeons while they are operating. They will put a echo probe down the pipe of the esophagus, the pipe of in the throat, and they will actually tell the surgeon whether they need to put a stitch more or the stitch is enough, that the leakage of the valve is become okay or not. So they are actually a very important support wing of cardiologists as well as cardiothoracic surgeon. And finally, there are doctors like me who have specialized in the field of preventive cardiology. That means they look at generally healthy people or those people who have undergone stents and bypass surgery and make sure that they don't fall into trouble in the future. So here we have such a vast explosion of knowledge, such a vast explosion of technology, such a vast of technical knowledge that is required, that it is now impossible for a preventive cardiologist like me to really practice frontline pediatric cardiology or to practice frontline electrophysiology. The equipment itself, to understand that, requires years and years of training, or to do interventional cardiology, or to do the most advanced technique of the support cardiologists, whom they call the non-invasive cardiology. So basically there has been a sea change, and this has happened, as I'm seeing, for the last 30 years that I have been a cardiologist. Imagine what is going to happen in the next 30 years. It's going to boom out with more and more investigations. I remember when we were in Nilratan Sarkar Medical College, we did not have electrolytes, we did not have sodium testing, we did not have potassium testing. They are now common garden. Every single laboratory now does sodium and potassium testing. Even a few years ago, a special kind of test, for example, a blood test called the NT-proBNP test or the D-dimer test, was not so commonly done. Now with COVID and with other things, now we have these things that are coming up and doctors are using it profusely. Another very interesting thing that is coming is that the patients are now becoming empowered and they are now helping the doctors in treating their own diseases by having devices. For example, everybody now knows of a pulse oximeter. Everybody knows how to use a pulse oximeter because of COVID. We have glucometers, for example. We have these little chips which measure the sugar. And the other day I had a patient come in, and in front of me he was using the machine to check his own sugar and telling me instantaneously what his blood sugar was. So blood sugars can be measured. Blood pressure, of course, has been there for a long period of time. Now people are using Fitbits and they are monitoring their rhythms, and we're telling them how to monitor the rhythms and come back to us if they're having the rhythms. So now there is being such a great symbiosis between patients, empowered patients who are helping the doctors in treating their diseases. They are now far more intelligent than the patients that were there before, because they are now understanding their problem. They are showing eagerness to understand their problem and to help the doctors in treating them. Doctors, I feel, should spend a bit more time. I think one of the main problems that the doctors are facing is that they're not spending enough time with the patients. I think they should spend a little bit more time into explaining to them. They're doing the right thing. If you look at the prescription, 99.9% is absolutely correct prescription. But often the patients are not very happy because the communication part of it, the telling them that this is the disease that you have in the terms that they understand. And then to explain to them why you are giving the medicine, what you expect from the medicine, how much time it will take for you to get relief from this medicine, what is a likely outcome from using these medicines. So these are the things that has to be told by the doctor. I feel that doctors should become more doctors and not mere technicians in just giving their diseases, giving their treatment. So I feel that there has been a sea change in what we used to do when we came out of college and what we are doing today. And I'm sure in the next 20-30 years, again, a massive sea change is going to come about in the field of cardiology. Right now, we are seeing 5 distinct fields of cardiology. Perhaps in the future, we'll see more. And I'm sure this thing has happened in many of the other fields also. I'm sure in gastroenterology. I know of orthopedics. There are specialists in knee surgery. There are specialists in elbow surgery. There are specialists in spine surgery. So this kind of specialization, sub-specialization has occurred in orthopedics. This sub-specialization has occurred in cardiology. I'm sure this such kind of sub-specialization has also come. For example, in gastroenterology, I know there are hepatologists who only look after the liver and don't look after the large intestine and so on. So this kind of this specialization has got its problem because it might create fragmentation of care. So you need a person to holistically look at the patient also. But the knowledge is booming so much. It's practically impossible. It's physically impossible. Perhaps artificial intelligence in the future will help us get a hand on all this kind of information. But right now, to keep abreast with a particular field of cardiology or a particular field of medicine is becoming very, very complex because the booming of information that we are now seeing.